Good afternoon, everyone. My name is Sandy Elliott Lonto. I'm a student at University of Massachusetts Global. I have here with me Mrs. Myra. She is a 45-year-old female that was African American that was recently diagnosed with major depressive disorder. Her psych NP prescribed her Celexa, so she comes to me to educate her a little bit about the medication. Hi, Myra. This is We're going to talk about this medication called Celexa that you have been prescribed. We're going to find out what it is, how it works, what a condition it can treat, what is the adequate dosage, what are the side effects, what is important for you to know about the medication, and how to follow up and how to store the medication. Celexa is the brand name of the medication of citalopram. So it's used to treat major depressive disorder, in short, depression, which is characterized by a persistent feeling of sadness, hopelessness, loss of interest in daily activities. You might have told your psych NP that you're experiencing these symptoms. That's why she put you on the medication. Okay. It belongs to a class of a medication called selective serotonin reuptake inhibitors. So what it does is that it increases the level of serotonin in your brain, and serotonin is a hormone that helps regulate your mood. Okay, so as much when it raises the serotonin in your body, as because you're depressed, you will start feeling better. Okay, again, the medication is FDA approved and it's one of the first line medication to treat depression, right? But it can also treat like general anxiety disorder, panic disorder, OCD, PTSD, eating disorder, nerve pain, migraine prophylaxis. So if you have a friend that's taking a medication but tells you that they don't have depression, just so you know, you can also treat these conditions. Okay. The recommended dose is 20 milligram per day. It can be a tablet, capsule, or liquid, and it can be adjusted. Okay, you don't have to stay at 20 milligram, but depending on how you are reacting to the medication, how you are responding to the medication, and how you can tolerate the medication, your provider can do so adjustment to it. Okay, it comes in a tablet form, capsule, or liquid. You can take it with food or without food. Okay, it's good. What are the side effects of Celexa? Can give you dry mouth, nausea, fatigue, insomnia. So people have reported sexual dysfunction from taking the medication. These are very common side effects. Other side effects that are very less common include suicidal thoughts or behavior. Okay. What is important for you to know as an African American is important to be aware of how Celexa may affect you differently than other individuals. Be sure to inform your healthcare provider if you have any other medical condition, right? Because Celexa can affect warfarin, which is like an anticoagulant, and also NSAIDs like ibuprofen, Advil, Aleve. If you're taking those medication, it can actually interact with Celexa. So make sure you let your psychiatric nurse practitioner know that you are taking those medications. If you are taking those medications. Inform your care team if the symptoms get worse or they don't get better. Celexa can take few weeks to kick in to actually start seeing results. So it's very important that you take the medication as prescribed by your psychiatrist. Okay. Watch out for worsening thoughts of depression, right? It can happen, like I said earlier, it's less common, but it can happen. So make sure you contact your psychiatrist nurse practitioner if you start experiencing those symptoms. Okay. Keep them out of reach of children and pets, and they store them in between 59 and 86 degrees. If you have any leftover medication or any expired medication, make sure to throw them away so you don't have to take expired medication. Okay. So to conclude, Celexa is a medication that can treat major depressive disorder. It's recommended that you take it exactly like your provider has prescribed, and make sure you reach out to your provider for any questions or concerns, or if the medication is not working, or again if you're having any suicidal thoughts. This is where I got the information from. Any question, concerns, you can also find this information online and get more information from there. Thank you, Miss Myra.